Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to start a new series on dysglycemia or hypoglycemia or hyperglycemia. Basically, people have hypoglycemic symptoms or high blood sugar or insulin resistance or diabetes. So I want to just go over some stats with you and then give you just a general overview. And over the next several weeks, we're going to go into the vicious cycles of insulin resistance and diabetes, as well as low blood sugar, which is hypoglycemia. Okay, so let's take a look. Global prevalence of prediabetes in the world, right? 26% of North America has prediabetes or diabetes. 13% of Europeans and 20% of Asian countries. So what is happening, right? Basically, 1/4 of the American population has prediabetes or diabetes. That's a staggering number, right? 1 out of 4. What is happening with these types of patients, right? Are they overeating? Probably. Are they having issues with insulin response? Yes. Are they possibly having autoimmune responses to the pancreas, like a type 1 diabetic? Yes. So there's a lot of different reasons why someone has blood sugar issues, right? So let's say your blood sugar is starting to creep up and your blood sugar goes above 100, maybe below 126 on fasting blood sugar, and you are kind of in that pre-diabetic range, or maybe you are at 150, right? But you're not quite at a diabetic medication intervention stage yet. So what happens with those types of patients, right? Most times when you go to your medical doctor, they're going to say the obvious, right? You have insulin resistance or pre-diabetes, and what you have to do is eat less, exercise more. So that is your typical recommendation. Eat less, exercise more. Now, for a certain portion of those patients, that could be the remedy, right? If you're that patient who drinks 2 liters of soda, gets up in the morning and has milk and Cheerios or Fruit Loops, have sandwiches and pizza for dinner and so forth, you may be that person. You may be eating too much and you're not exercising, you're stagnant. However, when you want to take those patients and say, you have to exercise more, and they try to exercise, and the next day they get up after the exercise and they're a complete mess. The joints hurt, muscles hurt, it takes them a week to recover. Why? Because there's inflammation associated with prediabetes or diabetes. So you can't just go rush into exercise when your body can't handle the load of the exercise. Certainly you could start with eating less, but eating less of what, right? It's important to understand that, right? Carbohydrates. People don't realize breads and pastas and all this stuff actually just turns into sugar or added sugar, right? Creamers and milk and sugar. You know, sometimes you go to like a Dunkin' Donuts or a Starbucks and you hear an order and it's extra cream with 5 pumps of caramel and 3 sugars. You're fueling your body with sugar. However, there are vicious cycles that can occur with insulin resistance and diabetes, meaning if there's inflammation associated with it, immune responses associated with it, gut dysfunction associated with it, it's not as simple as just going eat less, exercise more. And that's where we come in. As functional medicine practitioners, we look at the entire picture and say, how do we control a condition by using natural medicine and dietary changes? It's not just about eating less and exercising more, although there are certain portions of the population who can respond very well to that. So it's very important to understand there's a high prevalence of prediabetes, diabetes in North America. 1 out of 4 Americans, really, right? If you look at the obesity rate or people who are overweight in the United States, you're approaching 40, 50, 60%. It's a big health issue. So there's a significant impact on the expenditure for healthcare for these types of patients. and there are natural ways to go about this. On my last video, we talked about some of the statistics of prediabetes and diabetes here in the United States. It's basically 1 in 4 individuals who have prediabetes and diabetes. It's really an epidemic that is brewing and that is being managed poorly just by medications, right? There are things you can do, but you have to understand the vicious loops that it can occur because of high sugar or insulin resistance or diabetes, right? So in the diagram behind me, there's a lot of arrows. It looks a little confusing, but I'll try to go step by step and try to explain to you the vicious loops that can occur as a result of high blood sugar. So let's get into it. Insulin resistance or high sugar or diabetes and the vicious cycle. So hyperglycemia, right? This is the pre-diabetic, diabetic patient who has high levels of sugar in the blood. Hyperglycemia will create insulin resistance. What that means is if you take in a lot of sugar, your body's pancreas has to produce insulin. It produces excessive amounts of insulin. The cells for insulin become resistant, and you need more insulin and more insulin. So you develop a resistance to insulin to take the sugar because of high sugar levels. When that happens, your sugar levels will continue to go up because your insulin receptors are down and it can't take the sugar into the cells. Along with hyperglycemia comes what we call glycated end products. What that means is sugar will attach to either lipids or proteins, and it'll change the formation, right? It's basically aging it. So the glycation of an end product, proteins and fats, if you think about it like if you cook on the grill and you really get a nice char on a steak, that is a glycated end product, right? You're doing damage to the protein. The glycated end products will create inflammation because it's been damaged, and it causes inflammation in itself will cause glycated end products. So this kind of vicious cycle going back and forth between inflammation and the product of glycation or sugar attachment to lipids and proteins. Glycated end products, because it's damaged proteins and lipids, goes into the gut and creates leaky gut or intestinal permeability, right? Intestinal permeability will allow endotoxins. Things that should not cross the gut barrier will start to cross into the bloodstream, like lipopolysaccharides, right? Or toxins, any toxins. It'll start crossing into the bloodstream. And once that happens, you're going to have TLR activation, toll-like receptor. These are a class of proteins that is responsible for immune responses, right? So you're activating an immune response when you have endotoxemia or leaky gut, right? And then that activation also increases inflammation, increasing glycated end products. And then there are receptors, things that will bind to these glycated end products, and they're called RAGE reactions. Receptors for advanced glycated end products. Once that is activated, now you have increase in insulin, back to insulin resistance and back and forth over here. And then when you have hyperinsulinemia, high insulin, you can activate fat cells, adipocytes, right? When you activate fat cells, what does it do? It creates inflammation. So when you look at this cycle, there is a back and forth mechanism where these cycles will occur, one creating another and the other creating a problem back. So this is this vicious cycle of high sugar, inflammation, immune response, high insulin, and going back and forth and back and forth, right? How do we break this vicious loop? One of the most important ways to do it is to stop the insulin surges. Stop the body from producing insulin by taking in less sugar. That is one of the foundational pieces. How do you do that? Sometimes we'll use a ketogenic diet using more fats as a source of calories rather than sugar, right? So ketogenic diets are typically about 70% fat calories, 25% protein, and about 5% carbs. And it will produce ketones to be used for fuel rather than sugar. So in order to break this vicious cycle, one of the first things we might have to do for a patient is put them on a ketogenic diet. So just to recap, if you have high blood sugar, it creates insulin resistance, hyperinsulinemia, causes inflammation, immune responses, leaky gut, endotoxemia, where you get things into the bloodstream that should not cross, of activating the immune system, causing more inflammation. And guess what? This will eventually affect the brain, because if you get leaky gut, it's going to break down the blood-brain barrier, and it's going to create issues at the brain level. Low-grade inflammation, cognitive decline, short-term memory loss, and so forth. Okay? It's very important for you to understand that this vicious loop has to be broken. And over the next several weeks, we're going to go deep into diabetes, insulin resistance, or low blood sugar or hypoglycemia, and how all these things impact our systems. Because when you get glycated end products, right, because of sugar attachment to lipids and proteins, what are you doing? You are creating an environment for cardiovascular disease, blood clots, stroke, right? High blood pressure. All these things can occur just because there's too much sugar and too much insulin in our system. So it's very important to break this cycle for long-term health, because what's going to happen is you're going to end up on 1 medication, 2 medications, 3 medications, 4 medications, because sugar inevitably will also increase cholesterol, and then you'll be on a cholesterol med too. So to break this vicious cycle, it takes a little bit of work on your part and persistence to break this vicious cycle. Today, we're going to continue on the journey of dysglycemia, high sugar, low sugar. Today, we're going to talk about insulin resistance or prediabetes or diabetes, and the lifestyle factors that can influence prediabetes or insulin resistance, okay? So let's go into it. Dietary and lifestyle promoting insulin resistance, basically high blood sugar. When you have diet and lifestyle changes, so it typically starts as we get a little bit older, not as active, so not exercising as much, or overeating after maybe a hard day at work, and snacking more, and you tend to gravitate towards high sugar or high starch, right? Pastas, cookies, maybe ice cream after dinner, and so forth. And then it's the typical person who likes to socialize. You know, they're kind of full, they already had dinner, but they're socializing and having an extra glass of wine or beer, and then snacking on more foods, right? So it's basically pleasure eating rather than I'm hungry. And then the lack of dietary fibers, not eating enough vegetables, fruits, and so forth, of low glycemic index, to help buffer the absorption of sugar in the GI tract. So all these lifestyle factors are kind of your beginning signs of insulin resistance or heading towards insulin resistance. So if we look at symptoms of people who do this later, fatigue after meals is one of those clear signs. So they'll have something and they feel like they need a little nap. So the typical person is after lunch, they feel like a little drowsy, they want to take a little nap or close their eyes, or they'll go grab that second cup of coffee. And those are the people who have that little fatigue after meals. Crave sweets or sugars during the day. You're kind of snacking, right? Pretzels, nuts, something just to get some additional sugar content up. And then eating sweets does not resolve the craving. So you're eating it, but the hunger or the craving of more food doesn't subside, so you tend to overeat. And then difficulty losing weight. It's one of those telltale signs, right? okay, I'm going to go back to the gym, I'm going to walk and so forth, but you start to get what we call weight loss resistance. And it takes a lot of energy to burn off some fat. Over here, sweets after meals. Typically, after dinner, you come home, you sit down, you have a nice dinner, and then maybe an hour or two later, you're opening up the fridge and looking for stuff to eat. Chips, right? Ice cream, a cookie, right? Those are the people who are developing signs or early signs of insulin resistance or pre-diabetes. And then if you continue down this road, fatigue will set in and a lot of other clinical signs will start to show up. Chief complaints when people do come in with insulin resistance or high blood sugar or diabetes is the chief complaint is fatigue. I'm tired. I don't have the energy. I don't have the motivation and drive. Inability to lose the weight, right? I'm trying to get back on the road of exercising. I can't cut the weight though. It's not coming off. Pain, joint pain, right? My knees are stiff, my elbow, my shoulder, all these joint movements become stiff. Depression and mood changes. One of these telltale signs, right? Your mood will start to change when you have pre-diabetes or diabetes. What happens is the high sugar level starts to affect cortisol levels, starts to impact neurotransmitter production like dopamine and so forth, and your mood will start to change. So if you have high blood sugar and you have mood changes, they can be correlated. The other thing is infertility for women. I find that low blood sugar, high blood sugar are one of the main causes of infertility. High levels of cortisol, insulin, blood sugar, all these things that follow along with prediabetes can create inability to get pregnant. Thinning hair, one of the major complaints of women. My hair is thinning. Now there's different causes for hair thinning, like iron deficiency, thyroid issues, and so forth. But people do not realize that thinning hair is also as a result of high blood sugar. So when you have high blood sugar, basically you're damaging vessels, those small vessels, right? Your eyes, your feet, your scalp. When you do not get enough oxygenation and blood flow to the scalp, you will start to lose hair thinning. Hormone imbalance. Because sugar and cortisol are intertwined along with insulin and inflammatory processes, you're going to start developing feedback mechanisms that are dysregulated. So the hypothalamic, pituitary, adrenal axis, right? How things talk to each other or how insulin is released will start to cause imbalances of hormones, estrogen, testosterone, and so forth. And then when we start to get that obesity or belly fat, it starts to affect leptins and so forth. So hormonally, it makes a huge impact, especially when men are slightly obese. Those fat tissues will start to affect how testosterone is converted. So for men who have abdominal obesity, you'll take testosterone and convert it to estrogen, and you become more female-like in terms of hormone balance. And women who have obesity will start to develop a conversion of estrogen to testosterone. So these people start to change in their body shape, right, and morphology. So men will start to develop what we call man boobs, right? And women will start to grow hair on their chin and the whiskers, right? And things start to hormonally change. And it has to do with hormone imbalances, conversion of testosterone to estrogen, estrogen to testosterone in women, and how it affects hormonal balance, right? Blood sugar is crucial. In order to manage any patient who comes through our doors and they have a chronic issue, if they have a blood sugar problem, we need to address that immediately in order to help that patient get back to health. Today we're going to talk about blood sugar markers that will tell us if we have prediabetes, diabetes, or metabolic syndrome, okay? Or even diabetes when it's advanced. last week, or in the last video, we spoke about the different signs and symptoms, right? How does a patient present? What is their lifestyle? What are their dietary changes that affect diabetes or prediabetes? Today, we're going to talk about the different markers that you can actually get from routine blood work to determine if you have insulin resistance, prediabetes, or diabetes, okay? So, elevated blood sugar, okay? Blood glucose biomarkers. When your sugar starts to elevate, one of the first signs that you have insulin resistance, right? Early signs is that your blood sugar, your fasting sugar, is above 100. Your fasting blood sugar. So what that means is between a 10 and a 12-hour fast, and then you take it first thing in the morning after drinking some water. And then you'll notice that your triglycerides will start to creep up. Triglycerides will start to creep up and it will go above 100. Okay? That is your first earliest sign. Now there's additional advanced testing that might help us determine that when glucose seems normal and triglycerides seems normal, but you suspect that someone has insulin resistance. A test marker called C-peptide or fasting insulin can be helpful in determining if we have early insulin resistance, okay? Now, as we go from here and go into that definitive insulin resistance, we get into what we call metabolic syndrome, right? When we get into metabolic syndrome, we get central adiposity or fat around the waist, right? You're getting fatigued and you're getting these signs and symptoms, right? You crave sugars and so forth. Blood sugar in the fasting state will be 100 to 127 first thing in the morning. And then your triglycerides will start to creep up, okay? Cholesterol will be above 200, maybe 220, 240, 250. But these numbers, when you break down cholesterol, LDL and HDL will go in the opposite direction. So LDL will start to go up, maybe above 100, and HDLs will go below maybe 40. Okay, so when we have skewing of these numbers, then we have to suspect we have metabolic syndrome. Other markers like uric acid. So what's uric acid? Uric acid is what causes gout, right? Where you get the inflammation of the toe. So uric acid will also climb with high blood sugar. And then a real telltale sign is that your triglyceride number is higher than your total cholesterol number. If you have all these markers in here, then we are suspecting that you may have metabolic syndrome. These people will start to have issues with how the liver clears out, how their kidney clears out, and so forth. So this is a much more serious state when you have these types of numbers than over here. Here you can easily reverse. Here it takes a lot of work, a lot of effort on the patient's part to get better, okay? And then finally, when you get diabetes, your blood sugar, your fasting sugar is 126 or higher. And then something called hemoglobin A1C, right? Glycated hemoglobin is 6.5 and higher. When we get into this stage, we're causing a lot of damage to your blood vessels, right? Your kidneys, peripheral nerves because of circulatory issues, glycation, or basically sugars attaching to different proteins and fats will start to damage vasculature and nerve tissue. One of the leading causes of neuropathy or peripheral neuropathy is diabetes, right? And they have a bunch of different medications that help treat the symptoms of the numbness and tingling or burning in the feet. But in terms of getting to the root cause for diabetes, right, and reversing diabetes, takes a lot of effort and time on the patient's part. It's commitment to a strict dietary change in nutraceuticals. And then not just going and saying, I'm going to exercise more and eat less. Because when you start getting into this phase or this phase, exercise hurts, right? You exercise a lot today, tomorrow you have a hard time getting out of bed. everything hurts. And that pain may last, rather than 1 or 2 days, it might go 4, 5, 6, 7 days, right? Because what you do is when you exercise, you cause inflammation in these types of patients. So moderation in exercise in the beginning is important, not over-exercising. And then just dropping calories may be detrimental for some people just because they just don't have the energy, right? Fatigue will set in and they just don't have the drive and motivation to do this type of stuff. So it's very important to look at these types of markers, right? Glucose, triglyceride, cholesterol, and hemoglobin A1C. This is just your routine blood work, and it tells you a lot about a person. So when you have suspicion and you have all these signs and symptoms, if you went back to the last video, look at the signs and symptoms of someone having insulin resistance or diabetes, and then run these tests. Ask your doctor to run the tests, and you start to see these numbers change, and then you know you're heading down the wrong road. Today is part 2 of dysglycemia, and what do you look for on a daily basis? Last week we compared normal blood sugar and people who have hypoglycemia or low blood sugar. Today we're going to compare normal blood sugar and people who have high blood sugar or insulin resistance or diabetes. So when we have normal blood sugar, you wake up in the morning, you feel normal energy, you feel rested, and you're ready to go. When you wake up, you have normal appetite. You're hungry. You want to eat breakfast. You're not craving sugar. You just want to eat breakfast. Hunger between meals, but not sugar cravings. So between breakfast and lunch, you feel kind of hungry when you get around lunchtime. You don't feel like, oh, I want to have like a chocolate bar. You just feel like you're hungry and you want to eat something. There is no change in function between meals, meaning your energy does not fluctuate. Right? Your brain cognitive abilities don't change with or without the meal. Fatigue does not change, or your energy does not change after eating a meal. Okay? So it's normal blood sugar. When we compare that to someone who has insulin resistance or pre-diabetes or diabetes, they often wake up not feeling rested or recovered. Their body feels kind of very heavy. They have a difficulty time getting out of bed. And when they get out of bed, they crave sugar. They get sugar cravings. A muffin, cereal, right? Something sugary. They often will eat the high sugar and high starch breakfast, right? I need toast, right? Potatoes, a bagel, right? These high starch foods. You get more sugar cravings throughout the day. You fatigue after meals. This is a critical feature. After eating, what happens is that you get an upload of sugar and your body cannot handle it or process it correctly. Your body converts that excess of sugar into triglycerides or fat. The process of changing sugar to fat takes a lot of energy or ATP. Therefore, your body will start to feel fatigued after a meal. You crash after lunch. You're that person who gets lunch around, let's say, 12 or 1. Get back to the office. You're sitting there around 2 o'clock and you're nodding off in front of your computer. You're shaking your head. I got to get up, right? Therefore, you will crave a stimulant. You want a cup of coffee. You know that you're going to fall asleep or you're going to feel very drowsy and fatigued. So you'll get a cup of coffee to ward that off. And then you have difficulty falling asleep. What that means is after dinner, you'll sit on the couch and maybe you'll nod off because you have high sugar in your system, right? You start to nod off. And then when you actually get to bed, you're wide awake, right? You might lie there for 30 minutes, an hour, hour and a half, right? 3 or 4 episodes of Netflix, right? Before you can finally fall asleep. That's what happens with high blood sugar when you compare it with normal blood sugar, okay? So what I'm going to do now is compare or give you the most essential signs and symptoms of people who have blood sugar dysregulation. It's very easy, okay? If you have normal blood sugar, you will have no change in fatigue or energy. There's no change. Whether you eat or you don't eat, you might feel hungry, but your energy level does not change. With low blood sugar, right, or hypoglycemia, what happens is your energy improves with the meal or after eating. So you ever see that Snickers commercial, right? You're hangry, angry, hungry, right? You're irritable. And then as soon as you eat, you go, oh, I feel so much better. My energy's better. My mood's better. My headache is gone. With insulin resistance, there is fatigue after meals. So after you eat, you feel tired. You feel like you're going to doze off, right? You need a little nap. You crave stimulants. So the distinguishing factor, normal blood sugar, there is no change in energy with or without the meal. With low blood sugar, energy will improve after eating. With high blood sugar, you will actually get fatigued or more tired or sleepy after eating. It's a very simple thing to do, right? You need to figure out which one of these categories do I fit into. And if you do, you need to run the proper testing. Figure out where are you, right? How bad is my blood sugar? How bad is my low blood sugar? You need to figure that out to improve your health. Because if you don't, whether you have hypoglycemia or hyper or high blood sugar, it does damage, right? It does damage in terms of cortisol fluctuation, insulin fluctuation, inflammatory processes. A high blood sugar will damage your arteries and your vessels, right? Damages the small endings in the nerves, right? So it's very important to figure out early on where you fit in these categories to help yourself and improve your blood sugar. Over the last several weeks, we've been talking about dysglycemia, high sugar, low sugar. Today, we're going to talk about the impact of cortisol and stress on the impact of blood sugar. So let's get into it. So chronic stress response to the adrenal islet cell axis, how the adrenal glands affect the pancreatic release of insulin and glucagon and other hormones, right? So the chronic stress response, so chronic stress is ongoing glucose demand. So if you have stress in our system or in our body, you're going to have increased utilization of glucose and demand to deal with the stress, right? So if you're a high amount of stress, you start to burn a lot of glucose, and then you might feed yourself with simple sugars and other things to get your energy up. In that respect, it will start to cause dysregulation of cortisol and insulin. So what happens? When you have a high stress response over a long period of time, it starts to impact the HPA, hypothalamic pituitary adrenal axis, right? So how the brain talks to the adrenal glands. It will send signals and it'll increase cortisol, right? Basically a stress hormone. Increased cortisol will increase insulin resistance. What that means is that because of abnormal cortisol levels, your cells will become resistant to insulin and allow sugar to float into our bloodstream rather than be taken up into the cells, increasing blood sugar, right? So insulin resistance will occur, and there will be an increased secretion of insulin from the pancreatic beta cells. So because the cells are resistant to insulin, in response, the body will produce more insulin to try to take that sugar into the cell. And it causes a condition called hyperinsulinemia, right? Too much insulin in our system and become more resistant, eventually leading to diabetes. So when you have hyperinsulinemia, right, insulin activation of HPA axis, right? And then the chronic stress will also activate insulin. So this becomes a very vicious cycle where stress response affects the brain, the HPA axis, increasing cortisol, increasing resistance to insulin, increasing more insulin, and then now you have hyperinsulinemia. This vicious cycle of insulin resistance will lead to many other factors in our life, right? And we'll go ahead and talk about that on our next video. But lifestyle factors, chronic stress impacts brain, pancreas, adrenals, cortisol, and insulin. And they're all interrelated. In order to break someone's cycle, this vicious cycle of insulin resistance, there are many things you can do, right? One might be intermittent fasting. One is ketogenic diet. One is just eliminating simple sugars. But everyone's requirements are different. So that's where personalized medicine comes into place. Last week, we spoke about how chronic stress response will increase cortisol and impact insulin, causing hyperinsulinemia, right? Today, we're going to talk about the different lifestyle factors and how it impacts it. So lifestyle factors increase adrenal demand, causing dysregulation of blood sugar. So your lifestyle factors will start to impact diabetes, insulin resistance, or even hypoglycemia. So let's go into it. Overtraining. So there are a lot of people who overtrain who might undereat. And the long-term impact is that you increase long-term effects of glucose. Overworking, right? Working a lot of hours on the weekends, not getting enough sleep, all will impact the long-term impacts of glucose demand. Psychological stress. This is often not talked about too much in diabetes. But the fact that you are under psychological stress, emotional stress, right, can impact the long-term impact of glucose. So these physiological things that drive cortisol will impact insulin and how glucose is utilized in our bodies. Another one is missing meals. This would have a short-term or rapid need for glucose. So when you are a person who utilizes glucose too fast, let's say you're hypoglycemic, you're the patient who will eat a meal and 2 hours later you feel lightheaded and dizzy, I need to eat something, I get shaky, right? You are utilizing glucose too rapidly, right? And the missing meals will only exacerbate that. Another one is excessive simple sugar. What happens is if you use simple sugar, the body has to respond quickly to take it into the cells. And this vicious cycle of too much sugar in our system will lead to hyperinsulinemia, where the body is kicking off more insulin. And the cells become resistant to the insulin in our body. So it leads to insulin resistance. So things like overtraining, overworking, lack of sleep, psychological stress, missing meals, and excessive simple sugars will all impact cortisol and blood sugar. So in the lifestyle triggers, like these triggers, a healthy response to that would be no symptoms. Like you eat a meal, there's no symptom. You miss a meal, there's no symptom. You might be hungry, but you don't get shaky, lightheaded, dizzy, right? Or you fall asleep after a meal. So in the lifestyle triggers, a healthy response where the body's very resilient, you have no symptoms. When you have loss of stress response or resiliency, the body can no longer tolerate the stressors that we put on it, all these things that we talked about on the side. Then you start to get dysglycemia or dysregulation of blood sugar, insulin resistance, diabetes, hypoglycemia, right? So dysglycemia becomes an issue. And then it starts to impact sleep. And sleep is so crucial for healing, right? For our immune system, right? In these days of COVID, sleep is essential for our immune system. But people who have issues with insulin resistance or blood sugar dysregulation will always have issues with sleep. So the person who has high sugar has a tendency to fall asleep after a heavy meal because they're converting sugar to triglycerides and taking it into fat, right? That energy demand will put someone into a stupor, basically. they start to nod off after lunch or dinner, right? They sit on the couch after dinner watching TV and they fall asleep on the couch. However, when they actually go to bed, they have a difficulty falling asleep. When we have patients who have low blood sugar, oftentimes they're waking up 1, 2, or 3 in the morning because the blood sugar starts to drop, and the body's reaction is to increase cortisol to improve gluconeogenesis or improve sugar levels. So sleep issues come with hyper or high blood sugar and hypo or low blood sugar. Also, hypertension becomes an issue, right? Blood sugar will affect blood pressure. And then weight management. Too much weight gain and sometimes weight loss with hypoglycemia. And then immune dysregulation. So diabetes, insulin resistance will start to impact immune response. You have to remember, when you have fluctuations of blood sugar and fluctuation of cortisol and insulin that follow blood sugar, then you're going to start to impact your immune system, right? This day and age, we need to improve our immune function. And diabetes is one of those factors that impact immune dysregulation. So, loss of resiliency will lead to blood sugar dysregulation, insomnia, hypertension, weight gain, weight loss, and immune dysfunction, or basically a poor immune function, right? So when we look at these lifestyle factors, you have to consider how we are doing things that impact our lives. Obesity, weight gain is an epidemic in the United States, right? I would say about 60% of the population are overweight. 40% of them are considered, significantly overweight. And it's a big problem in terms of how diabetes, blood sugar dysregulation is managed here in the States. It's pretty simple. What you need to do is eliminate the simple carbs if you're the person who has that. If you have autoimmune disease that's causing diabetes, that's a whole different story. But just go back to the basics, right? Cooking your foods, fresh fruits and veggies and protein, and cut out all the simple sugars, right? Cookies, pastas, all these things that people tend to eat, especially during the holidays, which is coming up, okay? So make sure you have all these things in check so your blood sugar does not dysregulate. Today, we're going to talk about how insulin surges or diabetes or fluctuating blood sugar will impact female hormones. So we're going to get right into it, okay? So when we look at insulin surges in women, we're talking about a specific condition called polycystic ovarian syndrome. It occurs in a small percentage of women, but what happens is this condition will increase insulin resistance. So you're going to have a development of insulin resistance, especially if you're on a high sugar diet. And what happens is insulin will start to spike because the resistance to insulin. So basically your pancreas will create insulin to take sugar out of the system and put it into the cells. But if the cells become resistant to insulin, more insulin will be produced, causing insulin surges. Insulin surges, high levels of insulin, will upregulate a hormone in the ovaries, the thecal cells of the ovaries, called 1720 lipase. This in turn will convert female hormones such as estrogen into testosterone and DHEA. So what happens with this condition is, even in young women in 17, 18 years old, they'll start to develop little whiskers, right? A little hair growth, because they have increased levels of testosterone and DHEA. That in itself will increase insulin resistance, and then back to insulin surges. So if you look at this diagram, this vicious cycle can occur in young women and women of menstruation, where high sugar diets will promote insulin resistance, insulin surges or high levels of insulin in our system will upregulate our hormone, right? And then you're going to get a conversion of estrogen, testosterone, and DHEA, making them more man-like, quote unquote, right? More male-like features, hair growth, and so forth, and testosterone levels. So insulin resistance, insulin surges, and this constant upregulation of the hormones. And you basically, because of sugar dysregulation, you can develop more male hormones in women, right? This is a very important fact that is overlooked in terms of how it's being managed and treated in the conventional medicine. So it's very important that women understand that this is not a normal thing, or nor they should just take a medication for it. It's very important to help regulate this system, okay? Today we're talking about sugar dysregulation, diabetes, prediabetes, and hypoglycemia, and how it impacts male hormones. So let's get into it. Insulin surges and aromatization in men. What does that mean? Basically, you're taking male-like features or male hormones, aromatizing it, and you become more like a woman. Simply put, right? We're just making a statement here. So what happens with insulin surges and diabetes is that you're going to get aromatization. So what does that mean? So in essence, when you have insulin resistance or prediabetes or diabetes, it creates insulin surges. And the reason it does that is because insulin is utilized by the cells to take up sugar into the cells, right? But if you have high levels of sugar and you have constant flow of insulin or high levels of insulin, the cells actually become more resistant to insulin, and it's not as efficient as it used to be. And the pancreas will increase more insulin, trying to get the sugar into the cell, leading to diabetes. So you have insulin resistance, and which causes more insulin surges. And then what it does is insulin upregulates aromatase. Aromatase is primarily found in muscle and fat tissue. So men who develop the belly fat, right, this big round belly, and become more obese, they have more aromatization. What that means is you're taking male hormones like testosterone and converting them to female hormones called estrogens. So that's why this diagram says men, aromatizations, become more like women. And insulin resistance, hypoglycemia will also lead to diabetes. So when you have blood sugar dysregulation, you're going to get feminization of men. You're going to get more women-like features in men, more emotional at times. Men also will develop breast tissue, right? You've seen them, you go to the mall. They look like they could wear a bra. So in terms of male features, it starts to change to more some female features, right? So you have insulin resistance, you have insulin upregulation of aromatase, and then it converts, right? Testosterone, the male hormone testosterone converts to estrogens, more female-like. The increase in estrogen will create an imbalance or dysregulation from testosterone to estrogen ratio. So you're having an imbalance of your male hormones as a result of insulin resistance or blood sugar dysregulation, which in turn will increase insulin resistance even further, and you get this vicious cycle that needs to be broken, right? It's not simply you need to lose weight. People can't do that at times. So you have to kind of take it apart piece by piece and figure out where do you need to break this cycle so the male body can stop producing female hormones. So this entire process takes sometimes years to develop, because in the beginning your blood sugar dysregulation is not overt, right? You're eating a lot of different sugars and stuff, but your body's pretty efficient when you're young and it's still healthy. But as you get a little bit older and a little bit longer and longer, what happens is you develop insulin resistance to prediabetes and diabetes. Once that happens, you're going to get this aromatase, upregulation of aromatase and aromatization of your hormones, converting testosterone to estrogen. Okay, so men, be careful. Try not to overeat. In the last several weeks, we've been talking about different signs and symptoms of hypoglycemia or insulin resistance, high sugar and low sugar. Today, we're going to talk specifically about what type of nutrients might be helpful for those people who have high blood sugar or diabetes or insulin resistance. If you don't understand what insulin resistance is, go back several weeks and watch some of our other videos, which will explain the different signs and symptoms of insulin resistance. Today, we're going to just talk about different nutrients, okay? So when we look at it, the most important nutrients for diabetes and insulin resistance, we have about 7 listed here, okay? Number 1 on that list is called resveratrol. Resveratrol in the liposomal form, it would be highly effective in terms of blunting the oxidative stress and improving insulin sensitivity. So it's resveratrol. The other one, number 2, which is one of my favorite, is berberine. With berberine, basically it's golden seal extracts, etc. But if you use rosehip, burdock root, and alpha lipoic acid along with it, you can have a synergistic effect in terms of reducing the insulin resistance. Short-chain fatty acids. Why short-chain fatty acids? These are primarily found in the gut and certain types of high-fiber foods. But butyrate, propionate, and acetate is basically fuel for your gut. And your gut has a lot of responsibility in terms of hormone regulation, gut diversity, absorption, nutrients, and even sugar management. Number 4, glutathione. Again, liposomal delivery of form is best. We use a liquid form in our office that has a high absorption rate, and it's important for blunting the oxidative stress. Genema sylvestri, which is another nutrient. EPA DHA is fish oil, and then diverse fiber. For patients who have insulin resistance, what you want to do is be able to blunt the absorption of carbohydrates in the gut. And a high fiber diet will help do that. Another thing it will do, diverse fibers, will also increase short-chain fatty acids, such as butyrate, propionate, and acetate. So it has a twofold effect. One, it decreases the absorption of basically sugar in our gut, and it also improves gut function by increasing the fuel and creating these short-chain fatty acids. So we use something called a veggie mash. A veggie mash is basically taking a diverse group of vegetables that you would not typically eat, right? And then portioning it, cutting it down, dicing it down, and basically being able to grind or mash them up and have maybe even a teaspoon or 2 tablespoons per day, just to diversify the gut. The fiber is very important to improve gut flora and improving overall hormone regulation, immune system, in terms of healing the gut, such as leaky gut or intestinal permeability. So the top 7 nutrients are listed right here. Now these can be found in different companies, nutrition supplement companies. If you actually look on the link below this video, we have an online store, right? Within the online store, we have nutrients that are available. Now, we don't just go out and say, you can just buy whatever you want from our store. What you need to do is raise your hand and say, can I buy any supplements from you, right? So you can put your name or you can instant message us through the Facebook link and let us know if you're interested. There is a small process of getting you set up. But once you get set up, you can go ahead and order some of these supplements, right? We want to make sure the right type of patient is going to take the supplements and not just any random people, which can do more harm than good. Today we're going to talk about type 1.5 diabetes. This is not well known within the community or people who have diabetes, but 1.5 is a autoimmune condition. So let's go ahead and talk about this. So it's called latent autoimmune diabetes of adulthood, right? And it's called type 1.5 diabetes, and then for short it's LADA, L-A-D-A. Now, people don't realize when patients have diabetes or adult onset diabetes, it's not just about what they eat and what kind of diet they had or sedentary lifestyle they had. It could be an autoimmune process going on, right? Much like type 1 diabetes, which is diagnosed much earlier on in childhood, 1.5 can be diagnosed later on, above the age of 30, okay? So let's go into some of the facts. Type 1.5 diabetes looks like type 2 diabetes, right? Because it starts in adulthood. And then 10 to 15% of type 2 diabetes, the adult onset, may be actually 1.5 diabetes, the autoimmune version. So there's a lot of people who have diabetes, but a good percentage could still be just an autoimmune condition, not because they eat poorly and have a poor lifestyle. Now, 1.5 will start at an age above 30 typically, and 1.5 diabetes destroys the cells that produce insulin. Okay, so when you look at 1.5, it's basically type 1, but it starts in adulthood. The autoimmune condition does not manifest early on in childhood, it comes on later on. And this can be due to environmental factors, infection, and those types of things. But you have to look at these patients who come in, they're not obese, they have a relatively good healthy eating habit, they exercise, and they're relatively thin and fit looking, right? Yet they have diabetes and they don't understand why. Those are the patients that we want to check for autoimmune conditions, right? So how do we go ahead and check to see if we have type 1.5 diabetes rather than just adult onset diabetes? The antibody testing, right? So you can check to see if you have the autoimmune condition. The first antibody is called GAD65 antibody. Number 2, ICA, is islet cell antibody testing. And then the last one here is zinc transporter antibodies. Those 3 markers can help you decipher whether you have regular old diabetes, that you had a poor lifestyle, you had a lot of sugar, you don't exercise, you're sedentary and so forth, versus I'm thin, I work out, I try to eat well, but I have diabetes. Then you need to run these tests. Another test you can run is the actual insulin antibody. Right? These are all labs that you can run through your traditional labs, through Quest or hospital labs or LabCorp, right? It's not some special test that you can run through some specialty lab. It's a regular lab that you can check. So when you suspect someone has adult onset diabetes, right? You're looking at the classic example of a thin person who exercises and eats relatively well, yet they develop diabetes. Then you want to go ahead and check the antibodies to make sure they don't have that. Or if they do, the management will be different. So type 2 diabetes management is just eating less and exercising. But those people, it doesn't control their diabetes. The type 1.5, it doesn't control their diabetes. Eventually, things like metformin, those types of medications might be prescribed, yet the diabetes will continue to progress because it's an autoimmune condition. So you have to address the autoimmune condition by finding triggers. Is there chemical issues? Is there infection, right? Is there something that's affecting the pancreas or attacking these antibodies or these cells in our body? So it's important to find those things out so you can help manage someone who has an autoimmune diabetes or an adult onset diabetes. Today we're going to talk about environmental factors or triggers that affect diabetes. Oftentimes we talk about eating food, autoimmune disease, and so forth, but there are a lot of environmental factors that influence how your insulin signals your cells. So it's very important to understand these chemical factors that can severely impact not just the pancreas and diabetes, but other health conditions. So let's go into it. Environmental triggers that affect diabetes, or insulin, right? How the insulin is signaled. So there are many different types of things, right? Plastics, you have air pollution, pesticides, carpet glue, cigarette smoke, shower curtains, electronic wires, cosmetics, fire retardants, dry cleaning, non-stick pans, water from PVC pipes, and foods, right? So what is wrong with all these types of items? All of them are filled with chemicals, right? So when we look at air pollution, we're looking at PCBs. Plastic is bisphenol A or BPA, right? Pesticide, it can be arsenic, phthalates from carpet glue, benzene from smoke, formaldehyde, electrical wires. People don't realize that electrical wires have something called polyvinyl chloride, right? Which can be endocrine disruptors. Cosmetics have a lot of parabens in them. Fire retardants. A lot of fire retardants are being used. Mattresses, right? Things they don't want, furnitures. They don't want things to burn, but they use this coating of tetrabromo bisphenol A, right? Dry cleaning. When you use a lot of dry cleaning products, that dry cleaning, they don't realize that can irritate the skin, can absorb through the skin, and it can affect insulin signaling. Non-stick pans. This is an important topic. When people cook, they don't understand what they're cooking with. Non-stick pans have chemicals coated on it, right? So it doesn't stick. And what it does is it leaches into the food, right? If it leaches into food and you keep consuming it, over time, it affects how your insulin is going to affect your cells, or how your pancreas will signal the release of insulin. So it's very important to understand you should not use non-stick pans, but you should not use plastic bottles either, because plastics has BPA in them, right? You should be using either a good high-quality stainless steel or a glass bottle to carry water, etc. Don't heat things in the microwave in plastic tubs, right? Don't do it. Plastic bags, throw your vegetables in a plastic bag into the microwave, and you're basically infusing your veggies, which is supposed to be good for you, with BPA. Non-stick pans, convenience, yes, but is it going to be detrimental to your health over the long run? Absolutely. Water from PVC pipes, right? They are using, rather than copper pipes, right, or the metal pipes in plumbing, they're actually using plastics, right? And they're using it for hot water and cold water. Imagine hot water running through these plastic rubber tubings to deliver water to in the house, right? You're leaching chemicals into the water. Don't do it. It already has stuff in there, like chlorine. Food, glyphosates, right? Herbicides, pesticides, glyphosates, Roundup. All these things are endocrine disruptors. Now, listen, it's very difficult to avoid all of the chemicals, right? But you have to do the best you can. And you know the obvious stuff. I'm telling you, these are the things that are going to impact how your insulin signals your cells, right? Insulin signaling disruption. All of these chemicals, right, found in these products will increase your risk for diabetes. So whenever you can, you want to avoid, right? It's not possible to avoid everything, right? Secondhand smoke, right? You might have something in plastic temporarily. You might get a little BPA, right? You might need dry cleaning, but whenever possible, try not to use it, right? Foods, organic when possible. It's so important, right, to reduce your chemical and environmental load on your body. Our body is inundated with chemicals, right? Electronic waves from Wi-Fi, cell phones, cell phone towers, right? we're just inundated with all these different things in our body. In our body, it needs to adapt to it. We're not used to having all these chemicals in our body. That's why people are sicker than ever, right? We're supposed to get healthier over time, right? You should have better technology, better food, and all this stuff. But in actuality, the convenience of things, convenience of packaging and foods, makes it so easy for these chemicals to get into our system. So whenever possible, avoid these chemicals, right? Take a good look. Take a really good look at this, because you want to avoid these things whenever possible, okay? Today, we're going to talk about the clinical management of blood sugar. How do we in this office help patients manage low blood sugar or high blood sugar or diabetes, right? So when we look at it and we break this down, there are three basic categories, right? Hypoglycemia, which is the low blood sugar, or fluctuations where you eat and then maybe an hour or two later you have a quick drop in blood sugar, you get shaky, irritable, and you feel like you're gonna maybe even pass out, or you get angry, right? These are the people who have low blood sugar or hypoglycemia. On the flip side, we have patients who have hyperglycemia. These are the people who have diabetes, right? Or insulin resistance. These are the people who, after a meal, feel sleepy. They have a big dinner, sit down on the couch and fall asleep. So how do we manage these types of patients, right? The other one is autoimmune disease. With autoimmune disease, you have to find the triggers that create the inflammatory response from your immune system. So autoimmune disease, we talked about type 1.5. These are the patients who have adult onset autoimmune diabetes. It was not related to their actual dietary habits, right? So people who have autoimmune or 1.5 diabetes, they come in and they're of regular weight or slim, yet they're having issues with insulin resistance and diabetes. So in our office, we manage these patients differently, right? Obviously for different reasons. The number one thing is maintaining a specific diet for each category, okay? Number two is removing triggers that create this inflammatory response, especially with autoimmune disease. So what we're going to do over the next 3 or 4 videos is go over specifically what our clinical goals are for people who have hypoglycemia, hyperglycemia or diabetes, and then autoimmune disease. What is our clinical goal, and how do we know when these patients are getting better, right? Obviously, we can do laboratory markers to see and check if patients have these issues, and we can use those lab markers to see the progression of patients' progress. The other way we can do that is we can just look at symptomatology. Are there symptoms of high and low blood sugar improving over time, right? So now on my next video, we're going to talk specifically about hypoglycemia. What is our clinical goal and what do we expect in our outcome, okay? Today, we're going to continue on that journey of clinical management of dysglycemia. In the previous week, we discussed hypoglycemia or low blood sugar. So if you want to look at some of the clinical strategies we use, go back to the prior video. Go ahead and share this video and like it so more patients can see these videos to help manage their dysglycemia. Today we're going to talk about the management of insulin resistance, type 2 diabetes, or metabolic syndrome. All right? So the clinical strategies we use in our office. So if we look at it, basically when we have insulin resistance, metabolic syndrome, or type 2 diabetes, your sugar is elevated in the blood, right? And what happens with sugar elevation is that you start to damage peripheral tissues such as nerves, blood vessels, vision. You can also damage your kidneys. So it's very important to manage blood sugar, especially the elevated portion, right? So when we look at it, lifestyle is very important for management. So increasing exercise. So in the beginning stages of pre-diabetes or insulin resistance, in just the beginning stages where your blood sugar fasting might be about 100 to 110, 115, right? You want to be able to increase exercise level, reduce complex carbs, and reduce simple sugars. Pretty easy strategy. Increase exercise, reduce carbohydrates or simple sugars. When we get into more complex patients where we look at stage 2, these are the people who actually have diabetes. They might be on a medication like metformin, right? Or they might be insulin dependent. So there are a lot of people who have this diabetes and they don't know how to get out of it. Why? Because they'll start to exercise, but everything hurts, right? My knees hurt, my joints hurt. I'm completely wiped out and exhausted. The reason they feel this way is because they have an inflammatory process going on as a result of the diabetes. You have to first control the inflammation before a patient can actually exercise. So when we look at stage 2, we start exercise after inflammation is reduced. You have to check to see if that patient's inflammation is down. So you have to check things like ESR or CRP or C-reactive protein, right? You have to see if there's an elevation in those markers before starting aggressive exercise. Exercise has to be to tolerance in the beginning for the stage 2 type of patient. Then we have to get them a ketogenic diet and intermittent fasting. Now, I've discussed this in the past, so you can go back and watch some of my other videos about ketogenic diet and intermittent fasting. Essentially, what you want to do with ketogenic diets is that you want to utilize fats for fuel rather than sugars, right? So how do we do that? You have to increase good fat intake. It has to be at least 70% of your dietary calories in fats, followed by about 25% protein and about 5 to 3% of just carbohydrates or fruit, right? So you have to be very careful in terms of how you do this, because if you do not do the ketogenic diet properly, it actually causes more problems down the line, okay? So a ketogenic diet and intermittent fasting is a strategy when we have a stage 2 type of patient. Then you have to avoid AGE, which is advanced glycated end products. Things that are like a steak that's very burnt around the sides, right? It might be tasty, right? It's something that patients kind of like. But the advanced glycated end product will actually cause more problems for diabetics. The other one is you have to increase vegetable fibers. So even though you're on a ketogenic diet, you still have to have a good fiber content to manage blood sugar. So vegetable fibers, not fibers from fruit, okay? So, and the last thing is, we talked about this before, is reducing inflammation. You have to reduce the inflammation so you can increase exercise tolerance so the patient can get back to health. What's the point of exercising if the next day you fall apart? You're sore for 4, 5, 6 days and you can't recover very well. That in itself will cause more inflammation, more oxidative stress, and it actually will increase blood sugar. So you have to be able to understand what is causing your problem and how to attack it. Just doing more doesn't necessarily get you better results in the long run. Today we're going to talk about a comprehensive examination for those who have insulin resistance, diabetes, or what we call metabolic syndrome, right? Oftentimes, people are not diagnosed early enough to determine whether they have insulin resistance or diabetes. So diabetes is pretty rampant here in the United States, and it costs millions or even billions of dollars a year to treat these patients. So in order to figure out if we have a blood sugar problem, you need a comprehensive exam. And this can all be done through routine blood work. So it's very simple to do. So let's go over all the different markers that you can check to see if you have a blood sugar problem. Number 1 is fasting glucose. Everyone knows this. Basically, you fast for 10 to 12 hours, and then you do a blood test to see what your blood sugar levels are in a fasting state. That number should be between 65 and 99. And oftentimes, if it's elevated above 99, it's considered insulin resistance. Above 126, we're talking about diabetes. The other test we can do is called postprandial glucose. Basically, you can do this when at home. You have your normal meal, and if you have a glucometer or glucometer, you can test your blood sugar, and it should be below 140 at the 2-hour mark, okay? Now, these ranges are laboratory ranges, and now there are what we call ideal ranges, but for the sake of this lecture, we're talking about lab ranges, okay? So postprandial should be below 140 at the 2-hour mark. The next one is hemoglobin A1C. Hemoglobin A1C gives you a 3-month average, and it's 4.8 to 5.6. This one can be done non-fasting, so you can eat whatever you want because it's a 3-month average. Next one is fructosamine, and that's 190 to 285, non-fasting, okay? Glycomark is another test you can do, and that's 10 to 31, non-fasting. And the last one down here is glucose and insulin. It's a 3-sample test. They'll take a sample of your blood in the fasting state, so first thing in the morning, and they'll do an insulin and a glucose exam in the fasting state. Your second sample will be taken 1 hour after you have a sugary drink. Basically, they'll give you a sugary drink and you'll drink it, and 1 hour later, they'll do an insulin and a glucose test. The insulin needs to be below 164, and glucose needs to be below 199. Okay, at the 1 hour mark. Again, these are lab ranges. At the 2-hour mark, which is your third sample, insulin needs to be below 145 and glucose needs to be below 140, which is a 2-hour postprandial test. Okay, so these are basic markers that you can do to figure out what type of insulin resistance do you have, or is it early on, or is it your blood sugar looks normal but you have insulin spikes and those types of things. Other tests to consider when we look at blood sugar is a lipid panel, things like cholesterol, triglycerides, because they can be influenced by sugar or high glucose. CBC with differential, we need to know if we have anemia, because if we do have anemia, it is going to affect things like hemoglobin A1C. Another one is C-peptide. This is a really good test for insulin. It's a short chain of amino acids produced when they produce insulin. And the reason C-peptide is really good is because the half-life of C-peptide is longer than insulin. And you can check it. Insulin is cleared by the liver and C-peptide is cleared by the kidneys. So you can actually check C-peptide. You can get a pretty accurate read of how much insulin is being produced. So sometimes they'll do it with diabetics where people are using exogenous insulin where they're injecting themselves versus how much are we producing. So C-peptide is a very good test. Another test is C-reactive protein and ESR. And the reason why inflammation markers are important because it influences oxidation and influences some of the markers for glucose, particularly hemoglobin A1C. So I'm going to go into a little bit more in depth in a second here. So when we look at the comprehensive testing for diabetes, metabolic syndrome, and insulin resistance, right, we talked about the fasting glucose and the 2 hours postprandial. So obviously this is correlated with when you eat or you're fasting, etc. So the fasting glucose is, like I said, is 10 to 12 hours fasting. So first thing in the morning, maybe drink some water and just do the test. And it determines the severity of insulin resistance, right? So when we have, let's say, glucose above 99, let's say it's 110, and then you have rising triglycerides, that is your early signs of insulin resistance or metabolic syndrome, because triglycerides will go up when sugar levels will go up. So sugar might be like 110, but your hemoglobin A1C looks normal. Your 3-month average may look normal, okay? Even though this is an early indication of insulin resistance. Okay. The other one is hemoglobin A1C. Now, this measures glycation. Basically, hemoglobin, which is in red blood cells, right, binds to sugar. And hemoglobin A1C, the measurement is done by percentage of hemoglobin bound to sugar. So glycation is percentage of hemoglobin attached to sugar, right? And it's a 3-month average. And it is predictive of diabetic complications like kidney problems, right? Diabetes, liver dysfunction, etc. And it's also shows us that we're going to have issues with advanced glycated end products. Things basically attached to sugar. And it creates problems because advanced glycated end products need to be filtered to the kidneys, and the kidneys take a hit all the time. And then you start to see kidney dysfunction or deficiencies in GFR, glomerular filtration rates. And you'll see creatine creep up or BUN creep up. So when we look at the hemoglobin A1C, things like iron deficiency anemia will influence it. So you need to check CBCs and iron, etc. Kidney and liver dysfunction will also give you abnormal numbers for hemoglobin A1C. Blood loss, oxidative stress, and inflammation. So all these things can impact hemoglobin A1C. So that's why just one test is not going to cut it. You have to do multiple tests to figure out what is going on with the patient when they have dysglycemia. Fructosamine is another test, basically testing for glycation. And instead of testing for 3-month average, it is actually checking 1 to 3 weeks. Fructosamine is basically protein, basic albumin and IgG bound to sugar. Okay? And it's a 1 to 3 week lifespan. So when we have a patient, their hemoglobin A1C is quite high, they come in, and let's say we put them on a program or we do nutritional intervention, we want to see if they're getting better. And fructosamine is a good way to check because you're looking at 1 to 3 weeks of average, and we can figure out if a patient is really doing their job in terms of following a program. So the next one is called glycomark, and this is a hyperglycemic spike, right? Not a glycation event, but a hyperglycemic spike for 1 to 3 weeks. So when we look at blood sugar, even though the averages might look decent, what we want to look at is these insulin spikes and sugar spikes that go up and down and out of ranges. Because if you have high numbers and low numbers and they average out, it looks like they're normal. But if you look at the glycomark, you can figure out if their patient is having these big sugar spikes throughout the week. And it's a 1 to 3 week window. Another one is C-peptide, and this is related to insulin production, and I spoke about it just before. And basically C-peptide gives you an indication of how much insulin you are producing. So it's a great marker actually for insulin, C-peptide. Okay? Now, you have to be able to put all these together. It's like, why do we need to run all these tests? Because sometimes fasting glucose looks good, right? And someone fasted for 14 hours and their number is 95. Yet their hemoglobin A1C might be quite high at about 6.5, right? But if they have inflammation, kidney disease, we don't know what's going on, then you might want to check things like C-peptide, fructosamine, right, or glycomark. So these other tests can decipher whether someone is under oxidative stress and is causing abnormal numbers, or is the patient cheating, right? If they're fasting more than 12 hours for a fasting glucose test and the numbers look normal, then we can use these other numbers to figure out if they are doing what they're supposed to be doing, right? So all these markers can be run through your traditional labs. Now, I didn't even speak about, maybe autoimmune markers for diabetes, etc. These are just markers that you can do to see if you have dysglycemia, insulin resistance, or you have diabetic complications, right? Okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results. And we'll see you guys next week on the healthy side. Have an awesome day.